Hi everyone and welcome back to Chronically Cassie. This video is for any medical providers out there that I really hope come across this video. Often I hear and I've experienced doctors saying that they're frustrated because their patients won't follow their advice, or you are in situations where, the patient might be denied treatment because they don't follow advice. Or I've seen with myself literally being the last person treated in an emergency room because I have a history of not following orders. Have you ever taken a second to realize that these patients that don't follow orders might want to follow your orders but not be able to? What's even more alarming is that some of these people who could genuinely want to follow the orders given to them by a medical professional are then put on psych holds to test their decision-making capabilities. I'm just letting that sink in. Chronically ill patients have a lot of barriers to face. They have financial barriers due to being unemployed or underemployed, and then additional costs associated with their chronic illness. Here in Canada, we have amazing healthcare coverage, and the costs associated with being chronically ill are still high, so I can't imagine what it's like in other countries. In addition to finances, you have support. I personally am a single individual, but I know not every chronic illness person is. Some have families, some are single parents, some are looking after an elderly parent of their own. Many family makeups. But what supports do they have with their chronic illness? Think of it this way: a single mom of 2-3 kids. What support does she have to help her not only with her responsibilities, but with her chronic illness? Or maybe an adult looking after a parent with dementia, or just end-of-life care in general. What support do they have for their chronic illness? Or someone like me who lives alone. What support would I have for my chronic illness? Keep in mind that those with chronic illnesses often don't have the energy to build and maintain friendships. So the answer to what support sometimes can be friends, but isn't usually. And often it can include family, but not always, because a lot of us want to maintain that natural family relationship, and we don't want to turn the relationship of a loved one into the relationship of a caregiver. So sometimes family isn't the answer. So if you don't have family for support and you don't have friends for support, what support do you have to deal with a chronic illness? And I know the next one on your mind is probably going to be a caregiver. Caregivers usually cost money. Let's circle back to the fact that a chronically ill person is almost always strapped for cash, so probably wouldn't be able to afford a caregiver. And if they do, it's not a quality caregiver and it's not for many hours. So again, what support does a chronically ill person have? Now that we've talked about finances and support, let's also talk about energy. As a medical provider, you understand how these conditions affect our bodies. If our bodies are going through that process all day, every day, without a break, and we don't have that support, and we don't have the finances for the medications, the therapies, the equipment that could make our day-to-day life easier, after we've used up energy just by having our body try and maintain itself, and we've used up energy to do daily survival tasks like cooking meals and eating them, keeping the house tidy, taking care of hygiene. What energy do we have left? Because in a lot of cases, we're also not getting in our full 8 hours of sleep. So you have minimal support, no money, and almost no energy, because in addition to that, going back to the single parent scenario, you could have a single parent who also has childcare duties, or you could have someone looking after their elderly parent who has caregiver duties. There's not a lot of energy left to go into specifically managing a condition. Now I get that as medical providers, well, as human beings, you don't have a magic wand to wave and make a condition be well controlled. But approach can make all the difference. As a chronically ill person, we become near experts in our condition if you give us the resources and give us the time and help us understand. So we come to learn, hopefully, what our condition is doing to our body and what our body needs to be at its best in that fight against the condition. So sitting there with no compassion and saying to us, you need to do your therapy. You need to take your meds. I'm not going to treat you if you're not going to take your meds. That's not helping anyone. We already know what we need to do. You've told us we need to do therapy. You've told us we need to take our meds. We know that. We're not a bunch of rebels looking to cause trouble, looking to get attention. I know there's some great doctors out there, but not every doctor is phenomenal. I'm sorry. And I'm sure not every doctor out there has stopped to ask their patients, hey, I see you're not compliant with your medications. What are some barriers you're facing? Or, I understand that therapy used to help you. May I May I understand why you stopped the therapy? Is it that challenging to talk with your patient and understand where they're coming from? I get that we are in an overworked medical system, and almost every GP, family doctor, is at capacity in their clinics. But I'm sure that it takes just as long to say, I'm not going to treat you because you're not compliant with your medication, and to then get in a disagreement back and forth with your patient, as it does to say, may I ask why you're not taking your medication, and listen to their response. It might actually save you time in the long run with that patient. And again, I understand that some responses you'll get from your patients you won't be able to do anything about. But compassion goes a long way for your patients. For me personally, I want to share a story in my medical situation that I have many stories that I could share, but one that I feel best illustrates what's going on. I became a type 2 diabetic in 2017. I was put on metformin. I tried taking it, but I had the extreme stomach upset. I wasn't keeping hardly any meals down, and my body wanted me to live on the toilet. For any doctors watching this, you know the side effects of metformin. You can fill in where I'm being vague. But it was horrible. So I stopped taking my metformin. I didn't really have a support system I felt comfortable sharing the side effects with at the time. And I didn't have a family doctor. I was having my diabetes managed through walk-in clinics. So my pharmacy got upset because I was making a 1-month prescription of metformin last 2 months, sometimes 3. And my only support person thought I was skipping doses to get attention. My pharmacy threatened to not fill the prescription anymore. No one asked me why I wasn't taking it. Why didn't I tell anyone? Because everyone was saying I wanted attention. So were they really gonna listen to what the problem was when they had already decided the problem was that I wanted more attention? It took a switch in pharmacy and I don't know how long of talking to the diabetes nurse educators or whatever they're called, and a family doctor who didn't listen to switch me to long-acting metformin. And let me tell you, didn't my compliance go up a lot when the diabetes nurse educator, whatever you call them, asked me, why aren't you taking your metformin? I mentioned the stomach upset. She said, did you know long-acting metformin reduces side effects? I said, what's long-acting metformin? She was shocked I hadn't heard of it, because at this point, it had been about 3 years. 3 years into being a diabetic, and no one told me long-acting metformin existed, because no one asked me why I wasn't taking my metformin. So there goes the idea of a patient wanting attention, so she's skipping her meds, and we're just gonna stop filling the meds, and we're just gonna let her do what she wants, to, oh, this patient is having stomach upset, let's try her on an alternative delivery of the same medication. Oh wait, it works and her compliance is up. Which one takes less of the medical provider's time? Which one has a better patient outcome? And I know there's going to be somebody out there that says refusing to treat the patient takes just as much time as hearing them out, because if you refuse to treat them, then you won't see them again. That saves your time. That doesn't save time for the healthcare system, because that patient is just gonna tie up a walk-in clinic, go to another family doctor, or they're gonna get really sick from not taking the medication they need and end up in the hospital, taking time away from emergencies and taking up a bed. And I feel like the healthcare system operates as a whole, and doctors look out for doctors. So really listening to your patients and asking why they're not following your orders really does save everyone time in the long run.